Thank you for that nice introduction. We really appreciate it. And I wanted to say that my name is Susan and I stand for well-being for all. I'm delighted to have our panelists, and I'm really delighted that you chose to be with us today. We're going to tell you a little bit about breaking barriers, advancing equity, and transforming systems in Solano County. Really excited for this opportunity. And we're going to go kind of quickly, so thanks for your patience. Today on our agenda, we're going to provide context of the critical childhood development and milestones, describe who First Five Solano is and how they approach their systems work, especially in the area of equity. We'll share the results and how they are driven by accountability. And at the end, we'll leave you with some goodies to take away. We also provided a QR code. Who doesn't want a QR code? Woohoo! And that's so you can follow along with the presentation if you would like. And also it'll make it easier for you to access the materials that we're excited to share with you. So we've been talking about systems and integration and proper listening to community voice and all of the opportunities. And it's so exciting to get a chance to feature Solano First Five and all of the great work that they have done. When we talk about systems change work, we need to understand the foundations of collective systems level. And at ASR, we call that making sure that the conditions to do the work in the proper way have been cultivated. And I love it. Other people have been saying cultivate the conditions. So right on for us. Our idea about some of the conditions that need to be cultivated to really combine community level work with proper theories of change and then be able to monitor with program evaluation. We love the vision to achieve results. Results are precious. The collective impact approach means that we involve all that need to be involved and there is power shifted to those people. Accountability driven, are we making the differences that we wanted to? What can we do differently? Constantly monitoring. Of course, that leads to the ability to have a shared narrative, to speak in the same language about equity, about the values that we care of, and about how we know that we're making the difference that we strive for. And last but not least, to be properly resourced and invest in equity at all times. Those are the foundations that First Five Solano had, and these are the things that they have had in their entirety. And you're going to hear all about how that led to systems change from our two fantastic speakers. What we know. Okay, I'm going to go a little bit into the groundbreaking research that really tells us why we do what we do and what early childhood development and the life course means, not only to Solano First Five, but to many of you in the audience, particularly our First Five partners. So let me know, let me tell you in terms of understanding the context about the reason First Five exists and also why it's data driven and the approaches you'll hear about today. We know that each of us are born into a set of conditions: environment, socioeconomic status, genetics, maternal education, and mental health. And the ones that First Five Solano has been focusing in on is maternal education and socioeconomic status. So here's one way of looking at the life course, and you'll see another one coming up. These are the critical milestones along the pathway and the factors that impact them. And it does look similar to other words that are used: cradle to career, life course. These are the milestones that Solano First Five has chosen to really pay attention to, particularly the first three: healthy birth, parent-child attachment, and kindergarten readiness. And you'll also see underneath the levers for prenatal care, for healthy births, parenting practices for parent and child attachment, and brain development and kindergarten readiness. And all of these have a very important role to play in getting children ready to attend school. And of course, we have a brand new structure that exists there, and that's RTK, Transitional Kindergarten, and we love that so much. Solano First Five has determined its investments and the way that it does work and how it prioritizes based on these early childhood milestones. And then, of course, they lead to third grade reading, eighth grade math, and high school graduation. And there also, not only are there many other partners involved in all of these areas, but as well, lots of other systems that are connected to achieve these, especially as we get going on to the third grade reading. Parental involvement becomes a factor. Eighth grade math, the growth mindset comes into play. High school graduation, parental involvement, attendance, resiliency skills. So it's already a mismatch of different types of organizations and leaders. And First Five Solano made its funding decisions based on these levers and the milestones along the way. The Solano County Children and Youth Live in Poverty is a data set that we've been tracking for quite some time. The poverty level in Solano County has increased from 12% to 16% and now is higher than surrounding counties, but less than the state overall. And there's a really important part on this slide because it also reflects the impact that poverty has on families and their ability to be able to be kindergarten ready the way that First Five hopes. This shows the story of the poverty cycle, and it also shows by the age of 3, without adequate supports in place, children have heard 30 million fewer words than higher income brain development that we talked about. So that's really an important lever, and you can't undo it. And I know that we've heard that statistic, but it's really, really powerful. The higher poverty rates that are surrounding other counties, you can see that Solano County has 1 in 5 children ages 0 to 17 lives in the cycle of poverty. It's higher for children 0 to 5, and almost half of children with single mothers are living in poverty. So what's a First Five in a county to do? Despite Solano's poverty rate being the highest in the Bay Area, Solano receives the fewest dollars from philanthropic resources. And the First Five Solano First Five did a study to actually track this, and they've done 2 studies, and you can show there's quite a big disparity between what Solano County gets per capita at $3 per the rest of the Bay Area. As child advocates, First Solano's role incorporates everything that we just talked about: setting policy, directing resources, guiding the vision for improving outcomes for children and families, and advocate that resources are sufficient to meet their county needs. So families struggle to get the support that they need. Children and youth services that support achievement of milestones reside in completely different systems. Here's a mishmash of all the different systems that exist. And it causes the result that families need to navigate many different social, health, and educational systems to meet their children's needs. I mean, think about it. You've heard about it a little bit today. Forms, applications, websites, waiting lists, applications to wait, fees, callbacks, you name it. This is daunting even for folks with the time and financial resources, let alone those who are facing hardships. Faced with what seems an overwhelming and circuitous maze of services is really challenging. So that is the premise of this entire conversation we're about to have. The resources to address all of these life course factors are found across different silos, and parents and family members must traverse and navigate those silos. Within our organizations, we collectively have the opportunity and, frankly, the responsibility to make sure that our systems do what we need them to do so that access, experiences, and outcomes are equitable for all children. That's what we stand for. That's what you'll hear more from and our colleagues from First Five Solano. And now I'd like to introduce Lisette Estrella-Henderson.
Thank you, Susan. Before I dive in, I wanted to take the time to recognize an individual who has been a leader in this work in breaking barriers, and my colleague for a very long time, and now the current Solano County Superintendent of Schools, Dr. Nicola Parr. Thank you for your leadership in this arena. You certainly have been doing this work for a very long time, and just so proud, and wanted to make sure and recognize you. For those of you who don't know about First Fives, let me take a moment to explain who we are and what we do. First Five is a statewide initiative to support children 0 to 5 and their families prior to entering the school system. There is a First Five in every county, so there are 58 of us and throughout the state, and we set local priorities to address our local community's needs. Each First Five has a commission, and that commission comes together to set policy, to review our local data, to decide how to use First Five funding, given that First Five funding is dwindling, and how do we leverage and maximize the resources that we do have. I love how Dr. J spoke about coming with a different mindset about how we do have the resources, but the question then is, how do we leverage those resources and maximize them and stretch them, and then come together with local community partners? So that really resonated in terms of how we use our resources most effectively. So how do we do our work in Solano County? We have been very intentional, and especially working with ASR to gather the data of our local community and then come together to determine the needs of where we can be most impactful, because the needs are great. We provide high quality direct services so families and children can get the services that they need for us in First Five in particular to be ready for school, such as health, well-being, family support, as well as early childhood learning and development. We also leverage and partner to strengthen our systems that interact with early childhood families so that the future generations of our community have less of a struggle getting what they need, as Susan mentioned. Now, in order to invest in our children and families equitably, we knew we had to center equity in all that we do. We had to consider that not every child enters school ready to learn, and that disparities do, in fact, exist across the dimensions of equity. To address this, First Five Solano adopted the Government Alliance on Race and Equity, GARE, racial equity tool to guide our work. We know there are a lot of tools out there. This is the tool that we chose to work with. This tool ensures that equity isn't an afterthought, but it's a lens through which we view everything that we do. The tool guided us to define a clear vision of success, to help us as a commission analyze the data and what it was telling us, and partner with the communities most impacted, plan strategies that responded to real needs, and implement those actions that most allowed us to close those disparity gaps, and include evaluation of our impact. And I was very moved by the young people's panel right before our break, and really focusing on evaluation and their approach to evaluation. So thank you to our young people who are leading with their voice at the center. It's so cool to see. Today, we wanted to share with you how we followed each of these steps in this method. First was our vision. We had to define what we wanted the future to look like in Solano County for our children. To do this, we considered equity through the multiple dimensions of diversity and identity, including gender identity, immigration status, socioeconomic status, race, ethnicity, abilities, disabilities, language, and geography, and the intersectionality that exists between these dimensions. This is why equity work must look at the whole picture, because we're human beings and because children and families are multidimensional, and so our solutions needed to be as well. After understanding our vision as a commission and diving into what equity meant to us as an agency, we moved to answer, what data do we need and what does it tell us? First, we identified the common population level indicators to tell us how children and their families were faring across their life course in Solano County. For instance, how many children are living in poverty? What are our child abuse statistics? How many children are in preschool? How many adults have post-secondary education and are employed? We looked at this across the 7 dimensions of equity. From the common indicator data, we wanted to pinpoint which dimensions seem to reflect the greatest disparities in child and family well-being in our county. So, for example, we shared with you earlier in this presentation the importance of children attending preschool. And so we had to question, are there more children in one geographical area that are enrolled in preschool than in another area? Do these data vary by immigration status, by race, ethnicity, or by income level? Essentially, what were those markers that distinguished preschool enrollment between one group and the next? Second, we wanted to assess the magnitude of scope of the problem or the challenges. Through that lens, we looked at how many people are affected. Taking the example of preschool enrollment, are we talking about 10% or 80% not attending preschool? How big is this problem? What is the size of the disparity? Based on this analysis, we were able to determine that there were 3 dimensions where the disparities were the greatest and where we could have the greatest impact: geography, socioeconomic status, and race and ethnicity. Now, did that mean we weren't going to support children with a different immigration status or children that have disabilities? Of course not. It just meant that geography, socioeconomic status, and race and ethnicity were the dimensions where we were going to target to have the greatest impact on our disparity gaps. In the upcoming slides, I will share with you how First Five Solano in particular and our commission used geography to target and close the disparity gaps in our community and work to close those disparity gaps because we know that there's still more work to be done. Now, one of the critical things that we did when looking through the lens of geography was that we identified our indicators of child well-being by zip code. The template of this exercise will be provided to you at the end of this presentation if you would like to do the same thing in your own community. And I will have to tell you that I have continued to go back to this analysis time and time again when looking at how to target resources in a variety of different areas. So this was one of our target, one of the tools that we have used in multiple times in many different arenas. As you can see here, the indicators of well-being are across the top, such as poverty rate, foster care entry rate, unemployment rate, etc. Down the first columns, you will see Solano County's zip codes. To create this table, we took 9 indicators of child well-being and compared them to the Solano County's average. If the score was worse than the county average, that zip code was considered at higher risk for that particular indicator. If it was better than the county average, it was not considered as high a risk area. This table is sorted through from the highest risk to the lowest risk areas of Solano County. The dark green at the top right is the highest risk zip code. The area of the city of Vallejo was flagged in all 9 indicators of child and family well-being. As you go down the table, you will see that at the bottom is the city of Benicia, which had fewer levels of high risk indicators and need. This was a really interesting exercise for our team, and we have continued to look at it time and time again. It is not static. We continue to look at it on a regular basis and look at where changes do in fact occur. So, for example, at the beginning, we assumed at a particular area would rise to the top of the needs list. On the surface, it seemed obvious. You might hear someone say that there are areas in Vallejo, the particular area zip code. In this case, it was the Crest neighborhood. And you might hear someone say the Crest area is a dangerous place. But when the team analyzed the data, we realized that that assumption actually was not validated. This experience reinforced the notion that perceptions don't always match reality. And that you probably have that experience in your own communities and when you're doing community planning. And I think it's critically important for us to remember to always go back to what the data tells us and not focus only on our assumptions and what perception might be. It was through this process that we were able to clearly identify our primary areas of disparity and therefore concentrate our resources where children and families truly needed them the most. This map is a representation of the table I just showed you on the previous slide. The map shows the density of the flags, the number of indicators for which the zip code was faring less well than the county average. Again, the darker the color, the more indicators of need. If you look through the dimensions of geography, you would end up targeting 94590, the darkest green area. Based on the information from the table, you can see that the inequities that we are targeting co-occur. So even though in this view we are looking through the lens of geography, we are also able to address socioeconomic status and disparities faced by ethnic and racial groups. Again, that intersectionality is critically important, and it's what we continue to go back to. For us as a commission, this was a strategy to target our resources where they were most needed, to address the inequities from the team's multiple focal points, to work to strengthen families. At this time, I have the honor and privilege to turn it over to my colleague Denise, the First Five Solano Deputy Director, to share with you how this data informed the strategy we used to continue to work to address equity in our county.
Thank you, Lisette. Now, before getting started or getting into specifics, I'm going to go into the strategies that we use to address the disparities Lisette just shared with you. I want to share a goal from our strategic plan. We created a system change goal and supporting results. The goal is that early childhood systems are strong, integrated, sufficiently resourced, and equitable. We are aiming for 4 results: a strengthened system with increased capacity for providers, more integrated systems with cross-sector partnerships, expanded systems with sustained resources and legislative and policy changes, and a transformed systems so access, experiences, and outcomes are equitable for all children and families. This equity result is the area we are discussing with you today. Knowing that we were working towards, we then had to ask ourselves, what strategies will we use to advance equity? To help us figure this out, we went to the data. Based on this disparities map, we dug into our community to figure out where our highest challenged communities were, and that's where we placed our neighborhood-based resources. You can see where these hubs were placed on this map. The hubs I'm going to talk to you about are a First Five Center that we established in Vallejo, another one that we're in the process of establishing in Fairfield, and we are also in the process of converting an old school to the Rise Vallejo Early Education and Community Resource Center. The last dot on the map is for a small amount of services we provide via a local family resource center out of Rio Vista. While this is one of our cities with very few children, we decided to invest due to its geographical isolation and the inability of residents to access resources. Coming back to our GARE tool framework, we move on to partners because we can't do this work alone. First Five has always been a big community collaborator. We don't need to set our own tables. We know that there are many tables set in our community and many conversations happening about how to close the disparity gaps. So how do we make sure that we are all headed in the same direction? And how do we leverage and connect opportunities to maximize impact? This is where strategic collaboration across sectors is critically important and comes to life. The key collaborators we tapped into included school districts, cities, county government agencies, and our Solano County Board of Supervisors, Yocho Dihi Winton Nation, our local tribe, nonprofit partners, health plans, and local children's collaboratives. While the partnerships listed on this slide, we collaborated to bring the neighborhood hub initiatives to life. Today, I will be sharing 2 initiatives across 3 locations with you. I love this slide because it shows this adorable family at the bottom engaging in active play. Our first project to address equity through the lens of geography was to establish a First Five Center. The center is in our highest need zip code and is essentially a family resource center specifically for children ages 0 to 5 and their families. This center is our baby. We pretty much do everything for families from this center based upon what a family needs. The core work of this center is to strengthen the parent-child relationship. The center does this work in a variety of ways, like offering parent-child class series, such as Tiny Paleontologist or Eat, Play, Grow. The parents and children attend the class series and learn together. For example, in our Eat, Play, Grow class, the kids might come learn about carrots. They feel the carrot and peel the carrot. Well, actually, the parent peels the carrot, taste the carrot, and go home with a recipe and the ingredients to make a carrot salad. The next week, they can learn about tomatoes or oranges or a whole plethora of different types of activities to engage the parent and child. The other thing about this work that is critically important is how we engage with the family. Say the mom comes in 5 minutes early. She and the child are ready for the class. The child is rested and ready to learn. Great. Also say a different mom comes into the class 20 minutes late in her jammies with a child that has a full diaper and is hungry. We meet her exactly where she is at. We direct her to the restroom where we have a changing table, free diapers and wipes. When she comes back to the class, we get them a snack because we all know in this room we can't learn or engage hungry. And then we orient her and her child to where we are in the class and get them up to speed. The approach for this work is critically important as our space needs to be welcoming and safe for families to be who they are and where they are. We have found that we can connect with the family in a way they can hear and feel included, which helps us in building the relationship with the family and moving us toward trust building and eventually a positive change. We also make the space special for the children. The world is not made for the littles. Think about it. Toilets are for adults, chairs are big, spaces are stark and modern. Our space is different. You can see in this picture a little girl hanging out in an acorn, a magical space for children to burrow, read, share, or take a nap. We have potties and chairs that are the size for the children. Children's books are everywhere, and children always want to come back. It is interesting how the littles end up describing our space. Most children are excited about the tiny toilets just for them. Some littles are excited about the classes. Some like the books. Some like the ladybug structures they can climb on and the bridge they can walk on in our play area. I invite any of you wanting to see our space, please come down to Solano County First Five Center Vallejo and drop on by. You are more than welcome to join us. The parents like the parents like that our center is safe and in a typically unsafe neighborhood. They can get food, diapers, or anything else they need for their household. They can meet with staff to receive assistance in navigating multiple systems and their effort to support their family. In this photo, you can see a mom and daughter connecting during one of our self-care classes. The daughter was actually giving her mom a hand massage. No matter what brings a family back to us, we are sincerely grateful for the opportunity to walk beside them, supporting their efforts to meet their family's needs. This is a great example of someone who shared our values and our similar goals for their community. We said, great, it costs us $2 million to customize this space. If you get us $2 million, we can create a center in your community. We didn't think he'd do it, but sure enough, he reached out the next week and asked us for a proposal. We sent him a proposal for the $2 million, and it ended up in the state budget as an earmark. I share this because of how it came about. The mindset we had was that we were open to the possibility of what could be. By being open to possibilities, we were able to secure this funding. After we secured the funding, we went back to our map and determined which zip code in his district had the highest level of need. We then started looking for an appropriate property, and we couldn't find one. So we approached the city of Fairfield. We asked them to come to tour our First Life Center in Vallejo. And then we talked to them about trying to replicate the center in Fairfield and being unable to find an appropriate building to modify in our target geography. As it turned out, the city of Fairfield had recently received a grant to create a recreational facility in the heart of that geography. And they were building a community center on that property, along with multi-use fields and several play structures. The city said that they had the funds to build the building, but not to provide services. Since we had the funds to provide services, but not build the building, how about we partner? We gave the city our $2 million from the assembly members' earmark, and the city added it to their project to customize a space specifically for us. We are knee-deep in that, in the planning and the building, and I even got to pick colors last week. Again, I share this example because of the mindset needed to be open to possibilities. Was this a big lift? Yes, of course. Was this a risk? Yes. But it was a calculated risk based upon really good data and established relationship. Could this have failed? Sure. But at First Five Solano, we are incredibly lucky to have our commission with the mindset that taking calculated risks is what is needed to make significant change in the community. Plus, they understand that we cannot achieve our goals alone. Lastly, I want to talk to you about the Rise Vallejo Early Education and Community Resource Center. This project weaves systems, families, and neighborhoods in a way that creates a positive ripple effect through our county. Let me share with you how this project and idea came to be. There was a county facility that was housing 2 preschool classrooms which needed to be relocated because the facility was old and needed too much rehabilitation to meet ADA requirements to be kept. For 10 years, the child care provider was unable to identify a new space. The county administrator asked First Five if we could help. We began working with the provider and reached out to several groups: a real estate agent, the city, the schools, and our local recreation agency. We asked each group if they had appropriate available space to house these 2 preschool classrooms. After many conversations and many no's, we eventually had the school district come back to us and say that they didn't have available classrooms on any of their school sites, but they did have a shuttered school and were we interested in leasing the entire facility. That said, 18 classrooms was much larger than the 2 classrooms that we needed, but it sparked a discussion about the potential of utilizing the property for much more. We created a leadership team to consider what this could look like and the impact it could have. Together, we dreamed up an innovative model where we could use the school facility as an early education and community resource center. We could bring together local providers as a centralized location, offering the potential to expand their programs and have access to rent the rooms at cost, meaning each provider only pay their share of water, PG&E, landscaping, etc. But the facility cost would be free since the facility would be paid for. We could offer families in the neighborhood access to high-quality childcare, wraparound services, and safety for their children. Overall, we could create a supportive haven, adding more than 300 childcare slots annually for our community's youngest children. As a leadership team, we decided to pursue this and continue until we got a definitive no, this is not viable. Fast forward 5 years, and this project is almost in our rearview mirror. Looking back, we had assets and gaps we had to consider for the viability of this project. The assets included a facility, a strong leadership team consisting of First Five at the helm, the provider as a partner, and the County Office of Education, a commission willing to take calculated risks, political will, a provider with a strong infrastructure capable of taking on the operations, a champion with fundraising experience and legislative relationships, a known childcare need, a high-need location, which again aligned with our equity strategy, and no ongoing costs. The gaps consisted of a high upfront cost, which we didn't know at the beginning, no construction knowledge, and a 5-year time frame horizon that was unknown. Again, we had to consider if this project was worth the risk. We, our school district, our commission, and our partners decided that yes, it was. After investing $16 million, countless hours, many sleepless nights, and so many gray hairs, I am so pleased to share with you that we did it. Now, thank you. Now, this is work that required a substantial amount of collaboration from the key partners. We also pursued a variety of funders. We received state and federal earmarks. The county contributed funding to purchase and rehab the school. The city of Vallejo and philanthropy also contributed towards the rehabilitation. Finally, each of the key partners contributed their own resources. This center opens the possibilities for more children to access child care and preschool, for parents to return to the workforce or attend school, for providers to increase their capacity and quality of service, for community providers to come together, and so much more. We know this work will result in helping to prepare children to be ready to enter school and thrive, which, if you remember, is how we started this presentation. When children are kindergarten ready, this sets a foundation for better lifelong outcomes. When we invest in our communities and in our children, we all win. As our executive director says, my executive director is Michelle Harris, it's not a matter of doing something groundbreaking, it's a matter of need. Our children need us to think differently. I hope these examples show you a bit of how we at First Five Solano attempted to do just that for our community's youngest children. Across these investments it is critical that we show funding partners that we are worthy of their investment. We use results-based accountability for our programs. RBA is a framework to measure our program level impact in the community. We have to understand that population level change and program level change are two distinct things. Population level accountability is tracking the community trends we hope to influence. At that level, we are one of many contributors. On the other hand, program level accountability is what we commit to delivering the client level changes we said we would. At the program level, across our neighborhood programs, we gather data that helps us see, 1, how much did we do? 2, how well did we do it? And 3, is anybody better off? Here is an example from our annual report from last year. To answer the question of how much did we do, we served 1,810 individuals at our center. They participated in at least one class series, activity, or event. This provided us the opportunity to engage with the children and the family. Based on that interaction, families could choose to meet with a community resource specialist to assist with familial needs. And any children that look like they may not be on track to develop appropriately could participate in developmental screenings and receive appropriate interventions. We completed 219 developmental screenings over the last year at this center alone. Now for the question of how well did we do it? I will use the example of parent education. We offer an intensive PPP parent education course exclusively for the parents. The children are in a separate child classroom, which allows the parents to have authentic conversations about their parenting challenges. In those classes, we do pre-post tests, and 100% of our families who attended those classes reported an increase in knowledge of effective parenting strategies. Lastly, in thinking about is anyone better off? Why do we do this work? We want families to thrive. We want children to thrive. Like I said before, we offer classes like Eat, Play, Grow, and Tiny Paleontologists. Last year, we had 818 families participate in a class series. On their post surveys, 92% had increased knowledge of healthy behaviors, such as positive parenting strategies. You can see all of our program results on our webpage, as we are transparent about our impact in our community. I'm going to hand this back to Susan with Applied Survey Research to wrap up our session.
Thank you very much. We're going to close, coming full circle, say we talked about children's trajectory and taking a systems approach. Though Solano was woefully underfunded, they went ahead and did all of these amazing accomplishments with bricks and mortar, something you don't always see. The four-pronged system change strategy, specifically focusing in on equity at every single stage. Data provided a monitoring way to make sure that disparities were properly being addressed. Place-based hubs developed and demonstrated success using results-based accountability. The full circle is that investing early pays dividends throughout the entire life course. Create the conditions to cultivate this type of long-term, going to scale, equity-based investment existed with First Five Solano. They've been RBA practitioners since its inception 25 years ago. And I think that is the most important takeaway, is that the community, the commission was served by that vision of going to scale with the equity lens and being driven by community need and voice. As we said, we've got all of these opportunities for you to share. Here are our QR codes. You'll see some of the ways that the data are presented to make it so that people can communicate with a common narrative about what First Five is doing, and there is hope for families of all natures. Here are more examples. You can look at the data disparity table. We've used that, and that's been documented and used in Solano County for the Solano County Land Trust. Did the same thing, 0 to 24. They took it up and said, what else can we do? And they looked at the census tracts as well. The RBA framework, we're going to have a session after this, and we're going to go through the RBA framework, do a little workshopping so that you can leave with an RBA turning the curve, and also their systems change action plan. I wanted to say thank you so much for attending this workshop. Thank you, Lisette and Denise, also Michelle, who was the lifeblood of this presentation. And finally, I just wanted to say that there are other examples of ways that you can access data if you don't have this data. And I know I'm over time, but your data partner has to tell you. If you want to know at the individual level, look for Derek Peterson. He has got cool ways to have fun and talk about well-being and mental health. If you need county level data, you can use county health rankings. They are develop well-being data and equity data for all 3,000 counties in the country. They also have developed the health equity narrative, training us how to beat the dominant narrative and how to communicate with a common language. Also, we are members of iSchools, which is an international society for the study of quality of life. They're coming to the United States in Kentucky. They'll be having a session in Buenos Aires, and they have all of the other types of data that you can use to go to scale, and there are partners, and it exists. You can Google them. I want to say thank you very much, and sorry to rush you at the end. We look forward to seeing you at our session.